Welcome to the deep dive. Today, we're really getting into something fundamental, the link between personal growth and our mental well-being. How do they affect each other?
Yeah, it's a fascinating area.
So for this deep dive, we've looked at some great stuff articles on setting mental health goals, discussions about why mental health is so, well, foundational for development.
And that big meta-analysis too, right? Looking at the actual data, connecting growth efforts and our mental state over time.
Exactly. So our mission, really, is to pull out the key insights for you. How does intentionally trying to grow actually impact your mental health? We want to give you actionable stuff, maybe a few aha moments, without getting lost in the weeds.
Sounds good. Where should we start? Maybe that quote.
Yeah, let's do that. The one that goes, change is inevitable, growth is optional.
Mhm.
What did the sources say about that?
Well, the core idea is that, yeah, life throws changes at us constantly, but it's how we engage with those changes, how we adapt.
Hmm.
That's what determines if the growth is actually healthy, if it helps our well-being, or if it kind of backfires.
So it's about being active in the face of change, not just letting it wash over you.
Right. Healthy growth means actively adapting, consciously evolving.
Okay, so what gets people started on this path? What makes someone actually want to grow or improve?
The sources point to a couple of main things. Often it's the tough stuff, problems, difficulties. They can be real catalysts.
Like what?
Well, think about someone losing their job. That shock, that difficulty might be the very thing that pushes them to learn new skills, maybe even find a totally different career they wouldn't have considered
Oh,
otherwise.
like a health scare.
Exactly. A diagnosis can really trigger major, long-lasting changes in lifestyle. Things you might have put off for ages suddenly become urgent.
Right, those moments where you almost have to adapt. That's not always driven by crisis, is it? There's more to it.
Definitely not. Inspiration is a huge factor, too. You might read a powerful book or see a film that resonates.
Or see someone you admire making changes.
Yeah, or even just people close to you, friends or family, making positive shifts. That can absolutely spark a desire for your own self-improvement. It makes you think, hey, maybe I could do that, too.
One thing that really came through in the material was about why you want to grow,
Mm.
your personal motivation.
Mm-hmm. Crucial.
It's stressed that if it's not really coming from you, if it's more about like meeting someone else's expectations or pleasing
That's
others,
probably not going to last.
it needs to be authentic.
Yeah, it needs to be rooted in your own desire to evolve. Though, interestingly, some research we looked at showed that even goals that start out as externally motivated,
Mhm.
well, that they can become internalized.
Oh. How so?
If you start pursuing them and you feel like you're getting good at it, you feel competent, and you feel like you have some control, some autonomy, then that external reason can sort of shift into an internal one over time.
That makes sense. So it's not always strictly one or the other, but that initial or maybe the developing internal drive is key for sustainability. Right, that intrinsic pull, that feeling that you want to develop, not just because you feel you should.
Exactly. It's about becoming, a more complete version of yourself, not just ticking boxes for someone else.
Okay, so let's talk about something we all do. We have these big ideas like, I want to be healthier or need more balance, especially maybe, start of the year.
The classic aspirations.
Right. But why do they often just fizzle out, stay as wishes?
Well, the sources were really clear on this distinction between those broad aspirations and actual concrete goals.
Right.
Aspirations are those fuzzy desires. I hope. I wish. Goals, though, they need to be specific, measurable, action-oriented, the drill. SMART goals, essentially.
So I want to be more balanced is the aspiration.
You're right. But the goal would be something like, okay, starting next Monday, I will set aside 30 minutes 3 times a week, specifically for yoga or meditation. See the difference?
Yeah, it's actionable. You know exactly what to do.
Precisely. Without those defined steps, those clear actions, aspirations just tend to float around. There's no roadmap.
Got it. So making that shift from wishing to doing is vital. Now, something else heavily emphasized was how our mental health fits into all this. It's not separate, is it?
Not at all. In fact, the sources position mental health as absolutely foundational. Prioritizing your mental well-being isn't like a nice add-on to personal growth. It's the bedrock.
The bedrock.
Yeah. Good mental health basically gives you the capacity, the energy, the clarity to actually grow, to learn effectively, and to achieve those specific goals we were just talking about.
Okay, so how does that work? How does being in a good mental space actually fuel growth?
Well, there are several interconnected benefits that came up. Good mental health boosts your self-awareness. That's huge.
Understanding your own thoughts, feelings, patterns.
Exactly. Which you need, obviously, to know what you want or need to change. It also sharpens emotional intelligence and your ability to regulate your emotions.
So you handle ups and downs better.
Right. You can navigate challenges without getting completely derailed. Then there's resilience bouncing back and better stress management. Growth involves challenges, so you need ways to cope.
Makes sense.
What else? Better decision-making comes into play. Increased creativity, better problem-solving skills, even stronger relationships, which often support growth. It all links back to that solid mental foundation.
It really sounds like it enables the whole process. So if we drill down, what specific aspects of mental health are the real powerhouses here for driving growth?
The sources highlighted about 5 key ones. First, as we said, self-awareness, knowing yourself.
Okay.
Second, emotional regulation, managing those feelings effectively. Third, stress management, having healthy coping tools. Fourth, positive self-talk, that inner voice, making sure it's an ally, not a critic.
That's a big one.
Huge. And fifth, cultivating a growth mindset, seeing challenges not as failures or dead ends, but as chances to learn and get stronger.
Okay, those 5 really paint a picture. Self-awareness, emotional regulation, stress management, positive self-talk, and a growth mindset. So, practically speaking, what can people do to nurture their mental health to support this growth?
Well, the basics are often the most powerful. Prioritizing self-care, and that means real self-care, like getting enough sleep, eating well, moving your body. It sounds simple, but it's fundamental.
Often the first things to go when we're stressed, though.
True, which is why it needs conscious effort. Also, building and leaning on your support system. Friends, family, maybe a therapist, people you trust.
Having people to talk to. Yeah.
Absolutely. And setting realistic goals. We talked about goals before, making them achievable, breaking them down into small steps so you don't get overwhelmed and give up.
Prevents that feeling of failure if you aim too high too fast.
Exactly. Then there's mindfulness. Practices like meditation or even just deep breathing can really help with stress and self-awareness. And finally, a really important one, seeking professional help when you need it. It's not a weakness, it's a smart strategy.
Okay, those are really solid, actionable strategies. Now, you mentioned a meta-analysis earlier. It brought up this concept, Personal Growth Initiative, PGI. Sounds interesting. What is that exactly?
Right, PGI. So, personal growth initiative is defined as someone's active, intentional desire and effort to grow in ways that are personally important to them and doing it with full awareness. It's about being the driver of your own development.
So it's not just drifting into change, it's consciously saying, I want to work on this, and then doing it.
Precisely. It's proactive. And the theory behind it sees PGI as a kind of skill set. It has cognitive parts, thinking about what needs changing, planning, and behavioral parts, actually taking the step.
Thinking and doing.
Yep. And the core idea is that when you intentionally engage like this, it leads to higher levels of well-being, or what they sometimes call optimal functioning.
That makes intuitive sense. Did the research mention anything else about PGI itself?
One interesting side note from some studies is the idea that maybe a lack of PGI, a sort of disengagement from growth, could even be a subtle early warning sign of declining mental well-being. Like the mind signaling it doesn't have the resources to engage right now.
Huh. That's a really different angle. So this big meta-analysis, looking at 20 years of research, what did it find overall about PGI and mental health?
The main takeaway was pretty striking and consistent. PGI has a significant relationship with mental health. Specifically, it was negatively related to measures of distress, things like anxiety, depression, general negative feelings.
So higher PGI, less distress.
Generally, yes. And conversely, it was positively related to measures of wellness, like life satisfaction, positive emotions, feeling fulfilled.
Higher PGI, more wellness.
That's the strong overall pattern across many studies.
Wow. So actively working on yourself isn't just about achieving external goals. It seems directly tied to feeling better mentally.
That's exactly what the data suggests. The researchers even floated the idea that PGI could act as a sort of protective factor.
How so?
Well, it might help prevent distress from cropping up in the first place. Or if you are experiencing distress, higher PGI might help reduce it or help you bounce back more effectively after tough times.
Okay, that's compelling. Did the analysis get more specific? Did it look at particular types of distress or wellness?
It did. Empirically, they found significant negative links between PGI and depressive symptoms, social anxiety, overall negative affect, feeling sad, angry, fearful, and also functional impairment, which is difficulty with daily life activities.
Okay. And on the positive side?
On the positive side, higher PGI was significantly linked with more positive affect, feeling joy, enthusiasm, contentment, greater satisfaction with life, feelings of self-actualization, and even post-traumatic growth.
Post-traumatic growth. So positive changes after trauma.
Yes, the idea that people can experience positive psychological shifts because of struggling through adversity. Higher PGI was linked to more of that positive outcome.
That's really powerful. And what about change over time, like in therapy?
Good question. The meta-analysis included longitudinal studies, and they found that PGI levels tended to increase over time for people in counseling. And importantly, that increase in PGI was linked to improvements, less depression, less overall distress, and more general wellness.
So PGI isn't just a fixed thing you either have or don't. It can actually be developed.
Absolutely. It seems malleable, something that can grow, especially with support and intentional effort.
Now, meta-analyses are great for big picture views, but they often find nuances, right?
Hmm.
Was the PGI mental health linked always the same strength?
No, and that's a really important point. While the overall relationship is strong, its strength did vary depending on a few factors. They call these moderators.
Okay, like what?
One significant moderator for the link between PGI and distress was the specific outcome assessed. For example, the negative correlation between PGI and depression was stronger than the correlation between PGI and, say, acculturative stress or general negative effect. It suggests that maybe our drive to grow has a more direct, potent effect on combating depressive feelings compared to some other types of distress, like the stress of adapting to a new culture, perhaps.
Interesting. Were there moderators for the link with wellness too?
Yes. For wellness, the specific PGI measure used made a difference. There's an original PGI scale and a revised one. The original scale showed a stronger positive link with wellness.
Why might that be?
The researchers speculated it might be because the original scale tapped into aspects like life balance and finding purpose a bit more directly than the revised version. It just shows how the tools we use shape what we find.
Right, the specifics of the measurement matter.
Yeah.
Any other factors that seem to influence the relationship?
They looked at other things like the percentage of women in the study samples or how individualistic the culture was where the study was done. These factors showed some hints of influence, but
Not statistically significant.
right. In this particular meta-analysis, they weren't strong or consistent enough across all the studies to be flagged as significant moderators. They might play a role, but it wasn't definitive here.
Okay, so bringing this all together for the listener, what are the main takeaways here? What does this mean for you?
I think there are a few key implications. First, pretty clearly, actively nurturing your PGI. That intentional effort to grow really does seem like it could help reduce distress and boost your sense of well-being. It's not just wishful thinking.
It's backed by data.
Right. Second, maybe checking in with yourself about your own level of PGI could be useful. How ready, how motivated do you feel to actively work on yourself right now?
Yeah.
It might indicate your readiness.
And third,
Remember that PGI isn't fixed. If you feel low on it, it's something you can potentially increase with deliberate effort, maybe with support.
and maybe focusing those efforts is key.
Yes, that's the final point. Maybe think about setting specific, actionable goals that are directly related to improving your mental health as a really effective pathway for driving that personal growth.
So, to wrap up our deep dive, the big picture seems clear. Intentionally engaging in your own personal growth isn't just some nice-to-have idea. It looks like it's genuinely, strongly connected to better mental health, less distress, more wellness.
Yeah, the effort you put into improving yourself seems to really matter for your internal state.
And maybe the aha moment is just that realizing growth isn't passive. It's an active process. And taking that initiative, that PGI we talked about, seems to be a powerful lever you can pull to enhance your life.
It puts some agency back in your hands, doesn't it?
It really does. So here's something to leave you with. Knowing this connection now, what's maybe one small, really specific action you could take, maybe even today, to intentionally move towards growth and support your mental well-being at the same time? And think about that difference between just having an aspiration and setting a concrete goal. How could you apply that right now to something you want to achieve?